Hey everybody, welcome back to RN Cliff Notes, and today we are calculating cerebral perfusion pressure, or known as the CPP, right? Okie dokie. So this is RN Cliff Notes. We're helping students to see through larger concepts. I'm Cliff Davis, Associate Dean of Nursing, Advanced Medical Surgical Nursing Professor. All right, so what is perfusion? So write it down. What is perfusion to you? What does that word mean? Okay, so you hear perfusion and you say, right, that perfusion is the passage of blood through blood vessels. Now, of course, we could expand that and talk about lymph vessels and lymphatic fluid, but for our purposes today, what we want to do is focus on the blood aspect of it. Okay, and so I prepared this for you, and we've got this drawing where I'm demonstrating where the arterial blood is circulating in the brain, and we zoom in on it and spliced that artery so that you can see the red blood cells traveling through the artery unobstructed, right? But, so we've got our great cerebral perfusion right now. Right now, we want to know what causes intracranial pressure to increase. Let's think about that for a minute. What causes intracranial pressure to increase? Well, things like trauma. Some people, unfortunately, are hit their head up against windshields when they're in motor vehicle accidents. Some people, their intracranial pressure is rising because they have a tumor or mass inside of their brain. Okay? So those things are contributing factors. So like we said, cerebral edema, cerebral tumors cause ICP to rise. By the way, a little known fact that Bruce Lee, the world famous martial artist, the way he passed away, he actually passed away from cerebral edema. And that was due to his fluid and electrolytes being off, and his brain swelled, and he passed away. So yeah, that wasn't caught quick enough. Right? So now, as intracranial pressure, ICP, as intracranial pressure rises, then the cerebral perfusion pressure drops. So, let's pretend, right, that my arm is a vessel. My arm is an artery. An artery going through the cerebrum. And my other hand is the increasing intracranial pressure. And as that pressure increases, it comes along and it squeezes, right, and compromises cerebral perfusion pressure, right? So increasing ICP, compromising what? Cerebral perfusion pressure. All right? Now, as we look back at that picture, what we want to do is we want to compare the difference. So, in one picture, we've got what? Great blood flow. This cerebral perfusion pressure is fantastic, okay? But now we want to see compromise. So compromised blood flow, where this person has some type of tumor or cerebral edema for whatever reason, there's pressure in on the artery, right? And not nearly as many red blood cells are making it to the other side, right? So cerebral perfusion is compromised in this case. All right. So before and after. All right. So it's really up to us to fix it. By the way, let's challenge you. Since you're here at RN Cliff Notes, let's check you out. So what we want you to do is write down 2 medications. We want you to write down first a medication that would help to shrink the size of tumors inside of our patient's head. That'll be 1. Number 2, the second medication, we want you to identify the medication that would help address the fluid causing the cerebral edema. So as you think about that, right, that first one, if we're going to shrink a tumor, what medication would it be? And you should say something like what? Decadron, right? Decadron, right? The corticosteroid is going to help shrink that tissue down. Then when we're talking about cerebral edema, when it comes to fluid, you should have said mannitol. And mannitol is an osmotic diuretic. But catch that word. So we know diuretic, right? Causes what? Diuresis, urination. But we said osmotic diuretic. So that says it pulls fluid out of things, right? And in this case, it would pull fluid out of our patient's brain and bring it to the circulatory system. But now, with that in mind, we need to be cautious, because as that fluid is transferring from the brain to the circulatory system, we don't want to cause circulatory overload, right? So, all right. Good. So moving on. Now, we want to know what neurological structure controls blood pressure, pulse, and respirations. Now, you should have saw that other video on neurological anatomy and physiology. If you didn't, shame on you. Yeah, go check that out, all right? So, okay. But anyway, so here we go. Which one, what structure controls these things? And you say, our very special structure, what is it called? The medulla oblongata. That's right, the medulla oblongata, like we said in the previous video. Listen, I mean, everything else sounds just like normal, right? Midbrain, pons, and out of nowhere, what? Medulla oblongata, right? Like super special name, why? 'Cause it does super special things in the body, it controls those things. Alrighty, so now, what tragic outcome can result from failure to manage and or control ICP? And that would be damage to the medulla oblongata. Yeah. Now, here's the way to think about it. The brain is situated high up in the skull, and the medulla oblongata is underneath it. Well, the brain should be somewhat floating in CSF, cerebral spinal fluid. And what we don't want to do is to have the brain, the weight of the brain, and maybe a tumor or some other mass coming down, squishing on the patient's medulla. And we have to keep in mind that when we talk about the location of the medulla oblongata, is located, seated near your cervical vertebrae. And that solid structure, we don't want the brain, brain and tumor pushing and smushing the medulla oblongata against the upper portion of the cerebral spinal column. So, anyway, as we were describing, here's the brain, right? Okay, and here's the person's medulla as a part of the brain stem, and you see how it's situated. And like we said, if the person's cervical vertebrae is here, what we don't want to happen is some mass to grow or hematoma or something like that to cause the brain to shift down and smash what? The medulla. So, as we demonstrate that, it's critical that we control intracranial pressure and not allow it to increase and cause damage to the medulla and have it smashed or damaged, right? Okay, because then what happens? Our patient's pulse may stop. Our patient may stop breathing, right? Or lose control of their blood pressure. Okay, now, what is the acceptable pressure range of ICP? Hey, all right, we're going to give you several jewels in this video. You are watching the correct channel, trust me, okay? So, in the previous video, actually the very first one, we were talking about medical magical numbers. And those numbers were 3, 4, 5, and 7. And what do we say? Those are powerful numbers. You're going to see them over and over again. And you're about to see it in action right now. So, as we talk about the acceptable range of pressure for the ICP, we're going to use one of those numbers, and that number this time is 5. Okay? So, we take the letters I, C, P, and we assign 5 to each one of them, right? And as we look at our increments, what happens? I5, C would bring that up to 10, plus another 5 for P would bring our range up to 15. Yes? And the normal range for intracranial pressure is 5 to 15. Okay? Okay? You know, you're going to see that a lot in these videos. And we're going to use it to show you how to use the different numbers. So, all right? This way, instead of knowing it for the exam, you know it for life. That's what we're after. Steady, smart. Okay? All right, now, so the formula for calculating cerebral perfusion pressure is the CPP is equal to the MAP minus the ICP. Wow. Right? Isn't that, hey, check that out, right? And after watching this video, you're going to know how to do this. Okay? All right, I mean, hey, okay, this is solid stuff. So CPP and the MAP minus the ICP. So here we go. All right, and of course the MAP, right, stands for mean arterial pressure. Now, you saw that when you were in the hospital or a long-term care facility, wherever you were, that somebody was taking vital signs. And the vital sign machine was taking blood pressures. And then off to the side in the little corner it said MAP and it gave a number. And, you know, people don't know what that is. It's like, okay, you know, it's nothing I need to record, so forget about it. No, that's important. And when we're talking about neurological things, it's critically important, right? So, mean arterial pressure. Here we go. So, what I want to show you in this video, in addition to the thing we just did with the ICP, I want to teach you how to calculate the mean arterial pressure if you don't know how to do it. And after watching this video, you're going to know how to do it forever, right? Forever. Too easy to forget. So, here we go. Calculating the MAP is as simple as 1, 2, 3, right? Here's why. So, it's 1 times the systolic blood pressure plus 2 times the diastolic blood pressure. And whatever number we come up with, we're going to divide that number by 3. Hold on. Typically, when we look at blood pressure, right, many times it's the systolic number over the diastolic number. Yeah? So, what is it? 1 times the systolic 1 times the systolic blood pressure plus what? 2 times the diastolic blood pressure, and all of that divided by 3. See how that just went straight down. 1, 2, 3. Super simple. So, all right, let's see it in action. So, your turn. All right, so we're going to have you calculate the MAP. Now, we're going to do this to the nearest tenth. The nearest tenths place, right? For patients whose blood pressure is 120 over 80. So, go for it. All right? Okay. And as we go through the steps, we should see something like this, right? Like we just said, what? 1 times the systolic plus 2 times the diastolic. And whatever we come up with, we're going to divide by 3. All right? So, taking that a step further, put it back in our formula. 2 times 80 is 160. 120 plus 160 is 280. And 280 divided by 3 is 93.3. We said we were going to the tenths place, right? Okay, so the MAP, the mean arterial pressure in that case, is 93.3. Now that's a good one to know in terms of 120 over 80, because lately, I mean, we go back and forth with the blood pressure, what's normal. But acceptable ranges lately, you know, in many cases, 120 over 80. So for that 120 over 80, if that's the acceptable normal, then the acceptable mean arterial pressure would be 93.3. Okay? Super. Now, on to the next part. What is the acceptable pressure range of the CPP? So, all right, so we picked up a lot here. All right, so we already know that if we take the MAP and subtract the ICP, then we come up with the CPP. That should be CPP there. Okay, so let's see. Let's give you this. What you want to do is think about the CPP in terms of this. Think of it in terms of grades in school, right? When you get your grades back in school, I mean, there's an acceptable range, isn't that right? Okay? I mean, at some point it's like, not acceptable. Either 60 anything is not acceptable, okay? 70 to 100. 70 to 100 is the CPP. How about that, right? Awesome. But here, your turn. Let's see you do it. So I want you to take an ICP of, let's do an ICP of 20, and let's say that the patient's mean arterial pressure was 115. Calculate the CPP. So again, that was a mean arterial pressure of 115 and an ICP of 20. And what'd you get for the CPP? You should have came up with 95, right? Excellent. Okie dokie. All right, so we know that that's 70 to 100. Again, thank you for liking and subscribing, especially subscribers. Keep studying smart, guys. Thank you.